Hello and welcome to this week's What Were They Thinking? Among the news items for this week, we have information about the rather significant increase in the number of CCP virus patients in California. The number of hospitals being impacted by the CCP virus and just what you're seeing if you're on a ward. There's also been yet more interspecies transfer of the virus. This time, not so much between pets, but among apes. There's also a man who had the rather enlightened idea to inject himself with magic mushrooms. This led to less than desirable results. To begin with, the United States of America has now reported more than 4,000 CCP virus deaths a day. This is a new record. In the last week, there have been 3 days in a row where more people have died each day than the last. This is a figure that is rising at an alarming rate. This figure continues to rise despite the fact that vaccines are being rolled out across the country. Part of this can be explained by the fact that 30% or more of individuals who are eligible to receive the vaccine have refused it. This is despite being given priority access. What adds to this is that the government promised a very large vaccination program, and at least in theory, this could have been achieved. What has happened, in short, is 6 million people have been vaccinated or at least received a dose of the vaccine. Just under 22 million doses have been distributed. That means there is 21.4 million doses that, although being held at places to be used, have not been used. And that's another concern. This has set a situation up where people's confidence in the medical system is being hit right where it shouldn't be. That lack of confidence comes from the fact that the government has promised massive vaccination efforts, massive deployment of vaccine, but not necessarily been able to follow through on it, or at a state level been able to distribute the vaccine in an effective and efficacious manner. The number of people dying each day and the availability of vaccines is not the only concern. Across America, states are seeing an increase in the number of people being diagnosed. In LA County alone, they are getting close to 1 million diagnoses. Put in different terms, that's 10% of the county's population. That is a very large and very disconcerting number. Reflect on how many people around you in your life become ill with influenza each year. Is it 1 in 10 at one time? Or is it 1 in 10 across a year? Is it even 1 in 100? How many of those began falling sick in very short order, such as we're seeing here during the second wave? This second wave has led to a doubling of the case count in less than a month. That is a huge issue. In one county alone, the number of cases have doubled, and this is despite a vast array of restrictions that are meant to stop transmission. Combine this with events like the new variants from the UK and South Africa that are significantly more infectious, and you can begin to understand why California is struggling to get it under control. There were 318 deaths in LA County this Tuesday past. There were also over 14,000 new CCP virus cases in that same county. This figure is being artificially deflated, at least in part, as there's always a period right after the Christmas and New Year's holidays where the reporting figures are lowered, whether that's because of decreased testing, delays in reporting figures, and more. This can cause a slight lull, which is then followed by a rise again afterwards as those figures are reincorporated into the official statistics. Despite what is an official lull in the numbers, some patients are still forced to wait 17 hours to get into an emergency room. That is how long it takes to free up a bed for a patient who should be considered critically ill. They're in an ambulance. One silver lining to what we've mentioned so far is that at least in California, where Los Angeles County is located, the government has approved an expansion of the program to prescribe and provide the CCP virus vaccine. This is because they've been allocated large numbers, and as we've mentioned, a surprising percentage of people are not taking it. This means that there is excess that would otherwise have to be wasted. Rather than waste it, the government has allowed people who are in the wider scope of the vaccine program as it stands now to be able to receive that vaccine. As a rule, most vaccine recipients who have been prioritized are frontline healthcare workers, public health staff, such as those taking samples to diagnose the CCP virus, those who are in laboratories, pharmacy staff, and in some cases the elderly or those in elderly cared homes. The government has recognized that although they may not be giving the vaccine to those it was intended for, it's better to start vaccinating people now and get the next stage of the vaccine program running than it is to let these vaccines linger and then be destroyed because they've gone bad. News about vaccines, at least in California, does get weirder. In order to meet the needs, both at a practical level and at a level where people can actually access facilities, the government has set up what they call super clinics. These are makeshift locations that are intended to provide vaccines in a readily accessible way for many people, but also safely. One of these appears to be Disneyland. Yes, the Mouse House, Mouse Witch, the fantasy castle of your dreams, whatever you happen to know it as depending on your experiences there, has been repurposed, at least temporarily, as a vaccine distribution center. In news that's not as strange and unusual, but certainly positive, the Pfizer vaccine appears to work just as effectively against the new variants of the CCP virus as it does the original that it was developed to deal with. Whilst the results have not been peer-reviewed, they are generally consistent with the principles used to develop most vaccines and what we know of the new mutations. The initial results from this examination would indicate that it's effective against 16 different strains. At the moment, only 2 of these strains are a concern. Going from optimistic news to far less optimistic news, the goal had been with these vaccines to achieve herd immunity. The World Health Organization has put something of a cold shower on this idea, bringing everyone back to reality. They have said that herd immunity will not happen in 2021. That is even accounting for vaccination efforts. This is a concern as vaccines are seen as the primary way people can return to an otherwise normal state of being. That is, reduced need for masks, social distancing, fewer restrictions on visiting people, travelling, so on and so forth. This is a big thing. The impact of this virus on people's lives has been significant. In different countries, the impact has been different, but for most people, they have at some stage experienced some degree of lockdown, limitations on freedom. Others have had more severe impacts on their life, losing their jobs, and even more serious ramifications of the financial strain the virus has put on them. Herd immunity would have let people return to a largely normal life from before the virus came through. The companies that are largely responsible for producing the currently approved vaccines have said that they're optimistic that they can increase production, but within a week of that statement, the World Health Organization's chief scientist has warned that we are not going to achieve any levels of population immunity or herd immunity in 2021. We've spent a lot of time in past weeks talking about California and how hospitals there are struggling. Well, this is not a unique phenomena. Brazil, for example, is experiencing the same issue in their hospitals, where they have run out of oxygen for their patients. Brazil is the largest country in South America by landmass. Their population is vast, but unfortunately, so are the number of people dying. According to some reports, they've had to bring in refrigerated storage containers to store the deceased. That is how overwhelmed their medical system is. But it's also turning out that they're running out of oxygen. Quite literally, whole hospitals simply have no oxygen available. While that's bad, it's not the worst thing. They can't actually produce enough oxygen locally to supply the hospitals with what they need. In fact, they need 3 times the amount that they can produce locally. While California is at nowhere near that level, it's certainly the case that they're heading that way. In other news that is rather disconcerting, there is the first confirmed case of CCP virus going from a human to one of the great apes. This was one of the gorillas at the San Diego Zoo in California. They appear to have caught the virus from one of the people working with them. After being tested due to a cough, they came up positive with the CCP virus. Whilst it's true in most movies it's the other way around where an ape infects a human, it appears at least in this case that the humans have infected the apes. This has occurred after a year. That is how long the CCP virus has been going around now. You would think that by this stage, the world would at some point have been able to get into the original location where the CCP virus came from, but that has not been true. It is only in the last week or thereabouts that China has agreed to let a World Health Organization research team into the theoretical origin of the CCP virus. This effort is also being stymied by issues regarding visas. Specifically, that China has blocked the officials from the World Health Organization because they do not yet have visas issued by the Chinese government. This was a bilateral agreement to bring in researchers to look into it and investigate the origins. That is a big problem when you consider some of these people were theoretically in the air, or at least already well on their way to China when they were informed that their visas had not yet been approved. The effort to get the team on the ground and investigating not only to some degree the origin, but how the virus went from an animal species to a human species has been happening since July. It's now January. That means 6 months since efforts began, and more than a year since the first case was publicly announced. This means that it's going to be very hard to track the origins of the virus and figure out what is happening. In a related and interesting piece of news as such, the article you see here speaks about the technology being used to create the vaccine for the CCP virus, and how it has more applications than just for viruses in this particular instance. The way they're designed means that you can create a template of sorts that can train the immune system to target more and more specific things, particularly as the technology matures. Cancer is a very good candidate. Once you begin getting around the idea that cancer has a particular profile, whether that is mutations in it, whether that is the particular tissue, and other things that you could theoretically sample, develop a vaccine from, and then reintroduce into the host, you see that we can train the immune system to attack it very efficiently and very effectively. This would, in effect, do one of two things. It could be used to bolster the immune system, reducing the need for chemotherapy. It could also be used either with or instead of chemotherapy to more specifically deliver anti-cancer therapies. The ability to use the mRNA in it to target those cancer cells means you could inject a lot more of the treatment into a specific cell line, in this case cancer, than you could if you were having to dose the entire body, which is the current approach. Of course, mRNA is just one form of nucleic material. DNA is the other. And DNA, as we know it for the most part, is a two-stranded helical structure. Often you'll find in sci-fi settings that an extra DNA strand or more is somehow brought into existence, and this is used to explain all manner of phenomena. That's not as viable when you consider the mechanisms that exist to deconstruct, reconstruct, and multiply DNA in the human body. But that's because we have that two-helix structure. What if you had more? 3 or 4 even? Well, 4-stranded DNA has been observed in action, and watching what happens is really quite interesting. When you find something with more than a double helix, it's often the result of pathology, primarily cancer, but there are other ways it can happen, or a synthetic DNA strand. What happens when this occurs often requires particular changes in the way the DNA helix is made. This generally works with guanine, and guanine is one of the nucleic acids, and that's responsible for part of that particular 4-way helix. By being able to use that guanine and attach various signals to it, researchers were able to watch how it interacts with a variety of molecules and begin to unravel what's happening in these pathologies, or at least in the case of a 4-stranded DNA molecule. Of course, there are going to be more scenarios than just that. In other interesting news, there's a medical video of a human brain, that's been taken out of a skull and is able to be watched for a time. Most people will not get the opportunity to have a look at a human brain. Many students who study biology will at some point have the opportunity to dissect some sort of part of an animal. This could be any of the larger organs, such as the lungs or liver. It could include kidneys, the heart, or a brain. In some cases, you might be able to dissect an entire animal. If you ever get a chance to look at even sections or slides from a human brain, they are largely similar to animal brains, but being able to appreciate what you're looking at and just what it's capable of in regards to being part of yourself and what you are in turn capable of really does put in context just how amazing the human brain really is. Watching it in a whole state, freshly removed from the recently deceased, is rather underwhelming in some ways, but also incredibly interesting in others. The video in this case exists to make exactly the distinction we've just mentioned. If you ever have an opportunity to look at a human brain, you'll often find it's been processed. That is, it's become a cadaver rather than remains. The distinction is the process used to preserve the body, often formalin, which changes the very structure of the brain in many ways. Where the brain is naturally quite soft and squishy, almost like a jelly, the brain that's been processed is often quite hard and solid, surprisingly so. The video from the University of Utah Neuroscience Initiative is intended to give people an opportunity to be able to look at a brain before any of this has happened. An initiative that is nowhere near as impressive, we need to talk about a man who decided to inject himself with magic mushrooms in an attempt to have a better trip, let's say. Magic mushrooms are, as a rule, not meant to be used this way. They should be eaten or drunk, but either way, they go through the GI tract. The reason for this is rather important. The mushroom fungi can let out spores, even once dried and stored. If it's fresh, it's even more likely to secrete spores. These spores, under the right circumstances, such as in this case, where the man tried to make a tincture and tea out of it, can then begin to grow. All the more so if you inject them into your veins. The reason the GI tract is preferable is that the stomach acids and various factors that play in the small intestine largely prevent it from doing anything. It then has to compete with other pathogens, or more appropriately bacteria, and then the immune system. You aren't giving a very large dose of these spores directly into the bloodstream, where it takes time to mount that immune response. In this case study, the effects are also somewhat more acute and important. The impact of having injected the mushrooms directly into his bloodstream was that he developed organ failure. It would appear the lack of light in his bloodstream, along with the rather nutritious environment, had encouraged these mushrooms to start growing quite well in his blood supply. He was kept in hospital for 22 days, given antibiotics and antifungal treatments. He is also going to require long-term medical care, and even then, depending on how much damage has been done, he may not make a full recovery. Going now from the unexplainable behavior of one individual, we go to the unexplainable in space, or more accurately, the unidentified objects in space. The CIA has claimed to have released all of the documents they have on UFOs. And more importantly, not only are they released, but you can readily access them. It's often said that the government is hiding alien evidence in one form or another. That is, that there's some grand conspiracy that despite there being aliens about, that the government simply won't let people know. It would appear that they've now tried to mitigate some of that argument. These efforts aren't going to come from a good place. In fact, it's the result of a protracted legal battle since the mid-90s. After a very long effort, a group known as the Black Vault, which is who makes this information available to you, has been able to win their Freedom of Information request battle. The other effect of this is that the information, given how wide a period it covers, and the fact the government has been less than forthcoming in providing it, is that the information has very widely varying quality, some of it barely legible, and others highly redacted. This means what you get is going to be unpredictable. Our final piece of news this week that's astronomically related regards Starlink. Starlink is Elon Musk's attempt to create internet satellite services. There was, until very recently, a significant issue with this rather impressive project. Satellite internet to everyone on the planet would be great, but it requires tens of thousands of satellites. Many of these were visible to the naked eye. In fact, they were so prominent that they were photobombing astronomical photos. This meant that trying to view the starry sky would have smatterings of these satellites spread right across it. Starlink accepted that perhaps their approach had not accounted for this particular impact, and has attempted to mitigate the impact by altering their satellite design. This has significantly reduced the profile of the satellites so that they aren't anywhere near as visible. This is great for anyone who's looking up at the sky with their naked eye, and it's only going to apply for any satellites that are deployed in the last batch of 415 or any going forwards into the future, not any that have already been deployed. And there were 540 Starlink satellites, or possibly more, that were deployed before this. The problem does not fix one other major issue though. That is, what about astronomers, and particularly those who are trying to work from Earth-based facilities? These satellites are going to produce a lot of pollution, both in the form of interrupting signals, but also getting in the way of Earth-based facilities. It also doesn't change anything for anyone that is using a telescope. The fact that you have a magnified view of the sky means that what might have been invisible to the naked eye is not visible to those looking through their own equipment. A problem that will only get worse as their current permit has allowed them to deploy up to 12,000 satellites, and they intend to do so by 2027. They also have evidence suggesting that they have a longer-term plan for 42,000 satellites. That is a massive increase, and their current efforts aren't going to solve the problem for both telescope observations and for the hobbyist using their telescope. That's all the news we have for you this week. Thank you for watching this video. If you found it interesting, consider liking, sharing, and subscribing. Please post any comments, questions, or suggestions you might have below.